I joined Kaiser right after residency at Emory, and what I liked about Kaiser was it was very similar to the academic environment in that I was able to focus entirely on patient care. I didn't have the distraction of having to justify at every decision why I needed this test, why I needed that medication, why I wanted to do this. The entirety of my focus was on what my training was about, which is to take the best care of patients possible. I am trained as an internist, so I'm trained in internal medicine, which is general adult medicine, except that I see patients only in the hospital, which means that when one of our Kaiser patients comes into the emergency room or they come into the clinic needing hospital care, then I take over for the time that they're in the hospital. And my role is not just to take care of the patient, but I facilitate, communication with our subspecialists. If I need consults, I speak with their PCPs to get sort of some background information, but I am only in the hospital taking care of our patients there. One thing that's confusing to a lot of people about what Kaiser is, people don't really understand what's Kaiser. They don't understand that. They think it's just another insurer. But Kaiser is more than that. It's an integrated healthcare model, and that's a long term. But what that means is it's a whole system of information, and it's not just one doctor, but a whole network of doctors that are all working together with a common purpose. And the fee-for-service influence is eliminated. And what that means is fee-for-service medicine is what we have now. And every time a service is rendered, be it a consult, be it a test, be it a CT scan, a fee is involved, which means that sometimes the right thing happens, but perhaps sometimes there's an influence to do things for the fee that maybe shouldn't be there. But with the integrated model, the only influence that exists is to take the best care of the patient possible. The best care of the patient is the most efficient care. So the sooner I identify your problem, actually the less expensive it's going to be to take care of your problem. So Kaiser's an integrated model, meaning we don't pay each other for each little step that we do in taking care of the patient. We all work together for the common goal of taking the best care of the patient possible in the most efficient way.